Okay, it's awkward, so I just want to say something just because it's awkward. Hello? Was I
We're live, Brian.
That way?
Brian, we're live.
Oh my goodness.
All right.
Hello, everybody.
Hello, everyone. Good evening. My name is Lloyd Sheen, and I'm the chair of the Pleasant Hill Civic Action Commission Diversity Committee and Director of Alumni Relations at De La Salle High School in Concord, California. The Pleasant Hill City Council presented the Civic Action Commission with the charge to specifically work on more diversity programs, activities, etc. for the city of Pleasant Hill. The community conversations idea came out of discussions with Chief Brian Hill, Pleasant Hill Chief of Police, and the Diversity Committee of the Civic Action Commission. This is a continued conversation from our June 20th conversation with Chief Hill and Mayor Wren of where do we go from here. We wanted to continue the conversation and also invite a few more community experts to the conversation to help address areas of mental illness, housing, and homelessness within the Pleasant Hill community. In today's conversation, we will hear from Gigi Crowder, Executive Director for the Contra Costa chapter of National Alliance on Mental Illness, or NAMI, Jamie Jeanette, Community Engagement Specialist for Contra Costa Health, Housing, and Homeless Services, Amanda Cruz of the Pleasant Hill Martinez Coordinated Outreach, Referral and Engagement Team, or CORE, which works with homeless people in our community, Mayor Matt Wren, City Manager June Catalano, and Police Chief Brian Hill. To start today's webinar, we will hear from June Catalano, who is our Pleasant Hill City Manager. After that, our other panelists will each say a few words on behalf of their respective areas of expertise. Each panelist will speak for a few minutes on the range of responsibilities, providing insight into the planning that is ongoing in their specific areas of expertise as we move through the next few months and years. Throughout the webinar, all attendees will be muted, but will have the ability to use the Q&A and chat features available in the Zoom webinar on your screens to present questions. Once our panelists are finished speaking, they will answer questions that have been submitted in advance through the registration process, and also questions that come up through the Zoom Q&A and chat features. We will, of course, try to get to as many of your questions as possible within the next hour or so. If you happen to miss any of today's webinar or want to watch any part of the webinar again, we are recording this session and the video will be posted on the Civic Action Commission's diversity webpage, pleasanthillca.org/diversity. At this time, I will turn the webinar over to our esteemed panelists, starting with June Catalano, Pleasant Hill City Manager. June?
Thank you, Chair. Thank you. And thank you to the mayor and the police chief, the Civic Action Commission, and the Diversity Committee for having these very important conversations. As city manager, I'm committed to making sure Pleasant Hill is safe and well managed on behalf of all of our residents, our visitors, and our businesses. These are very challenging and very uncertain times. And I think one of our great strengths in Pleasant Hill is listening to and working with each other on behalf of the entire community. And this is certainly an important venue to be doing that. I would like to note that 3 years ago, in June of 2017, the City Council adopted a resolution that said the city would be welcoming, inclusive, tolerant, and safe for everyone. That resolution was a guiding policy for the city staff and was actually part of a stimulus for the CAC to begin having conversations about diversity. I'm looking forward to hearing from the panelists tonight and from the community. We're always available at city staff to answer questions and hear suggestions from the people we serve. So with that, I will turn it back to our chair.
Thank you very much, June. Now I'd like to introduce Ms. Gigi Crowder, Executive Director for the Contra Costa chapter of the National Alliance of Mental Illness. Gigi?
And I'd like to say thanks for having me here. And I'm really pleased that you have such an opportunity for me to share mental illness is one of the, what we call a public health crisis, and too often is left out of the conversation. So I'm really pleased that here in Pleasant Hill, you have a committee such as this one that's chaired by someone with lived experience. I know that we're working toward having opportunities for communities that don't often have a voice at the table to be lifted up. So Pleasant Hill is actually ahead of the game from having a committee such as this one. I'd like to share that mental illness affects 1 in 4 individuals. And because we're in the midst of a pandemic, most of us have had our mental health challenged. So it gives us an opportunity to have a better understanding of individuals who live with more severe mental illnesses, their day-to-day challenges. What we like to do at NAMI Contra Costa County is make sure that we're fair and equitable, and we're providing services that meet the needs of all individuals impacted by mental illness. We're pleased that we continue to have an office in Pleasant Hill where we have Crestwood. We still kept our NAMI office no matter what, because that's the largest pool of individuals who live with the most severe mental illnesses. And we needed, even after moving to Concord, we wanted to have a presence. And so our peer-ran programs are still running there after Crestwood gave us the space some 10 years ago. There are disparities in mental health. So too often when individuals live with mental illness, how their outcomes can somewhat be hampered by their ethnicity. So in most counties, states, cities, individuals from particular groups too often get their services in the most restrictive environment. So at NAMI, we made an effort 2 years ago to start hiring reflective of the individuals that we see in our communities. And we've done a great job at that, with that. So we've removed language barriers. We have specific age groups that we cater to and needs. And so I'm just happy to be a part of this conversation and look forward to any questions that come my way. A top priority for us right now is working on having a non-police response. Police officers should not be the first responders to individuals in mental health crisis, because it is indeed a medical condition. And so we're trying to support cities to have their law enforcement focus their attention on other matters and not individuals who are experiencing a medical condition. So thanks for having me.
Thank you very much, Gigi. Now I'd like to introduce Ms. Jamie Jeanette, Community Engagement Specialist for Contra Costa Health, Housing, and Homelessness Services. Jamie?
Hi, everyone. Let's see if I can get my technology to work here. All right. Is it working? Slides are showing? Slides are showing? Okay, great. Sorry. So I'm Jamie Jeanette. I'm with Health, Housing, and Homeless Services for Contra Costa County. And I'm going to just paint a real quick snapshot about homelessness in the county. And then I'm going to have my colleague Amanda talk a little bit about what's happening on the ground. So, some of my pictures didn't come through, but that's okay. So this just, I'm not going to spend a lot of time on this, but the short version of this is like, we're in a housing crisis. We've been in a housing crisis for a long time, and we don't really have enough resource in this community of Contra Costa, or really throughout the country, but especially on the West Coast, for people that are experiencing homelessness. Prices of housing have gone up, production has dropped, and for example, just with shelter. So if we have 100 people in our community in Contra Costa that need shelter, we only have 28 beds for 100 of those 100 people. So that is part of why you see people living on the street, living in encampments, and that people are more visible, because as the numbers increase, we really don't have extra shelter capacity. We're also, and I'll talk about this in a little bit more, but we also have an increase in older adults. That's one of the populations where we're seeing the biggest increase. Let's see what's happening. Some of my slides are not coming through. I wonder what's going on. Well, hold on one second. Oh, the pictures can't be displayed. Oh, that's going to be interesting. Okay. Well, always a fun technical challenge. So the slide, and I will give it to the city so that they can be posted later. One of my slides was showing essentially there's a couple different ways that we gather data about what's happening in the county around homelessness. One is something called the point in time count, which is just like a one night snapshot, and that tells you about a third of what's really happening. So it's not a complete picture, but communities across the country use this same process, so they can kind of compare apples to apples through the federal government. And this is the data that gets used to make decisions around funding. So 2020 data is not available yet by city, but just wanted to show 2018 and 2019 data. These are the number of individuals found in each location on the night that we did the count. So in 2018, there were 85 individuals found that had slept in Pleasant Hill that night that were experiencing homelessness, and 59 on 2019. The data for the city should be out in a couple weeks. For this past year, I don't have the city level data, but you can see the sort of trends. So we're seeing a slow decrease. It's really not changing that much. And then you can also see sort of the breakdown by age. And then you can see a little bit about like what's happening for people that are experiencing homelessness. So I'll say this is self-report. So this is like what somebody's willing to tell a total stranger. But 52% of the adults that are homeless in our community through the point in time count reported having a mental health condition. And about 50% had substance abuse issues. And about 45% of adults said that they had a chronic health condition that could actually include mental health, but often maybe more like a physical disability. And you can get more information on the report. The link is right there. So the other thing that we've done in our community is we've looked at all of our service data. We also gather data of everybody that's accessing services, and we can actually look over a year, everybody that's accessed services, and we can take a look at a bunch of different aspects. So I won't spend a whole lot of time, but I wanted to highlight that we have looked at a bunch of different angles around race and ethnicity and sort of who is experiencing homelessness, like who's presenting at the front door, and then what kind of extra issues may be going on, and then what do housing rates look like. So a few things I wanted to highlight is, so for African Americans in our community, they're overrepresented in who's experiencing homelessness by about 4 times. And there's a bunch of reasons for that. So, we're finally having big conversations about sort of systemic racism and inequity, and those are all the drivers that help lead to these numbers, unfortunately. If we look at the unsheltered population, so this number includes people that are in shelters and then people that are like living in cars or in a tent or whatnot, we tend to see more white folks living unsheltered, so in a car, on a bench, in an encampment, than other racial and ethnic groups. And so again, this is like, could be a whole presentation, but I just wanted to pepper a few things in here, and you can do a much deeper dive if you want. So this is just a little bit about domestic violence and self-reported mental health disabilities. And then in terms of housing placement, so actually we see that about 40% of the people in our system coming in are African American, but actually African Americans are getting about half of the folks that are, and people of multiple races are getting exited to housing. And we have a fairly small population of American Indians. So those numbers are really small, but if we look at the whole data set, tend to have lower rates of when we say positive housing exits, that basically means getting housed. So just a real quick snapshot of like what's available to people. If somebody is in Pleasant Hill and they're experiencing homelessness, like what is available for them? So there's 3 ways that people can access services. So they can call 211, which is a toll-free number. They can access that 24/7. And they'll be asked some questions and kind of sorted and assessed to see what they actually need. Care centers are daytime drop-in centers. So you can get showers and laundry and some food and case management. So there's one in Richmond and one in Walnut Creek. So it's Trinity Center and GRIP. And then CORE, which you're going to hear a little bit more about, is our mobile outreach team. So they're going out and they're connecting with people that are living unsheltered or maybe, struggling with housing and they don't have transportation. So CORE is really out there primarily to support people that are unsheltered. And you're going to hear more from Amanda about all the great work that they're doing. And just again, a like very quick snapshot of the different kinds of things that might be available to people once they kind of hit that front place. So prevention is to keep people from becoming homeless. Rapid resolution are resources to help keep somebody out of a shelter. So maybe there's another safe place that they could live with a relative, or if they had a little extra money, they could patch something together. That's what this is about. Crisis services is really core, and also our care centers where people are in crisis and they need some immediate service. Crisis housing is shelter. We have services to help people get into housing, and then we actually have housing programs that have sometimes ongoing supports for people. So in terms of core, I just wanted to, again, this is like a way more data than you can probably look at right now. But just wanted to do a snapshot for the last 2 years for core data in Pleasant Hill specifically. So our core teams worked with about 270 individuals, and they had multiple contacts, and that's not uncommon. That's actually what we want to see, that they had many contacts with some of the same people to sort of start to get them connected into what they needed. 23% of the people that were found to be homeless actually lost their housing in Pleasant Hill. And about 60% of the people that are homeless in Pleasant Hill are here because they're connected to this community in some way that usually predates their homelessness. So either they grew up here, they have family, friends here, this is the city that they know, or their supports are here. In terms of age distribution, like this again is just for Pleasant Hill. So you can see it's vast majority adults, and we're starting to see this population of older adults increase more. And then I just wanted to highlight disabling conditions because I know part of the focus of today is really around mental health. And a lot of folks, this isn't all mental health, but these are people that have disabilities that or have health issues that are disabling to them. So you'll see of the people in Pleasant Hill that are experiencing homelessness, 57% of them said they had a disabling condition. And for many of those people, it actually is likely a mental health or mental health or addiction struggle that they're having. So that was super fast. There's my contact information, but I want to turn it over to Amanda to talk. I think Amanda's next to talk a little bit more about core outreach. And I'm going to stop sharing my screen so we can go back to faces.
All right. Hello, everybody. My name is Amanda Cruz, and I'm a lead outreach specialist for Core Outreach. And so we really are boots on the ground team. So there's a few ways that you can access our services, like she was telling, the 211 calls will go wherever the person is at. Doesn't matter if it's in a creek, in a field, on a mountaintop. We literally will go boots on the ground and go out there and talk with them and find out what is it that they need, what is their greatest challenge, what barriers are in their way, and we find ways around that. So we help connect clients to many different things, and our approach is client focused because not every homeless person has the same barrier. And so we go out and say, you know, some people might need to get connected with some kind of cash aid, GA, Social Security disability, unemployment. We literally help them apply for that. If it even means bringing an unemployment application or a GA application out there and filling it out with them, and then going back and bringing it to the office and doing all those little steps to be able to get these people that would never been able to access services because they can never get to the office or they have problems focusing. So a lot of people with mental health, substance use, we connect them with programs. We get people cell phones. Right now we're doing that through the mail because of the COVID. We also connect people with, like I said, mental health and health services. We do like COVID testing right there on the spot through HCH, which is Healthcare for the Homeless. We are doing hotel referrals for people who have chronic health conditions that make them extra vulnerable for being out around the COVID. And so we're doing that right now, and we've actually managed to get quite a few people that have been chronically homeless for years that have never accepted help into these hotels. And so now we're working on getting them housing, so it's really a great thing. Another thing that we have is the Housing Disability Advocacy Program, which that helps people Jamie was saying that a lot of the clients in Pleasant Hill are have disabling conditions, whether it's substance use, mental health, and chronic health conditions, and a lot of those people don't have benefits. So we'll get them connected with first the general assistance disability, and then assist them on getting to SSI, and there's funds for them to be able to be housed once we get those things in play. And you know what? I just want to say that we really do have to go out there and build a lot of good relationships with these people, because they don't have family members that look out for them. They don't have, they're oftentimes alone. And so really when court goes out there, that's that connection that they're making to be able to, help them, push them along and say that they can do this and we can do it and whatever, they can go through these problems and we're not just going to leave them behind, and so we want to try to get everybody housed. Not everybody wants to be housed, but we want to try to baby steps and get them into housing. So it's really a great pleasure to work on court, and I'm honored. So any questions, or are we going on to the next?
Thank you so much, Amanda. We'll come back with questions momentarily, but let me just introduce Mayor Rinn and Chief Brian really quick. Mayor Rinn, City of Pleasant Hill Mayor. Want to say a few words for us, please?
Yeah, no, I want to leave as much time as we can for our panelists here today, and I just wanted to send our appreciation for all of you making time for this important conversation. And what I'm doing is taking some great notes here, and part of the process is listening, and really trying to, when somebody has that conversation, to hear what's being said and to learn from it, and then make appropriate action plans going forward. So I just want to thank our panelists for being here today, and appreciate your time and your energy and your expertise, because we're, it's a community. Like we've all talked about our communities, that everyone kind of represents their specific specialty, but really it's bringing everybody together to be part of the solution. So I just want to thank you all for that. And I'll turn it over to the Chief so he can go into his things. But thank you for having me.
Thank you, Mayor. I too will be brief so we can jump into the questions. A couple things that I want to point out, and that is we're here to make Pleasant Hill a better community. We're here to make Pleasant Hill better for every single person in our community, and a safer community for all. And I think as I look at the panelists, it's just so indicative of what it takes to make a great community. We have our mayor, our city leader, our city manager. We have nonprofits. Thank you so much, Gigi, I'm sorry. And we have county. I mean, really, isn't that what it really takes? Isn't that what it's going to take? And then we're going to have other conversations with faith-based groups, our youth, and I am committing myself or our department to come out and speak to any group, to be quite frank with you. So just to reiterate just a little bit what the mayor has said, and it's so important, is that truly we're here to listen. And I don't want that to be a buzzword, because I think it has become a bit of a buzzword. And so we are here to listen, and we are here to see what we need and should put into action as a community. And I would say that kind of indicative, again, is we've had conversations with Gigi. We've been working with CORE for a long time. The council has previously had a resolution of our commitment to diversity. So I think we've been committed to this, and we're going to continue to get better. And so I'm super excited about that. And so thank you, Lloyd. Thank you, Civic Action Commission. And I will stop talking so we can have questions and interact with our community.
Thank you very much, Chief Hill. To start off the questions, we will continue with what Amanda was in CORE, and we have a question: how is CORE funded, and what % is local versus state resources?
This is Jamie. I'll answer that. It's a great question. So we have about 14, I think, CORE teams now in our community. When we first started out, we only had 3. And actually Martinez and Pleasant Hill was one of the first teams. So the cities of Martinez and Pleasant Hill came together and said, we really want to have this resource in our community, and we want to fund a team that works just in that jurisdiction so that we know that our constituents are really getting what they need. So the core team in Martinez and Pleasant, that's split between Martinez and Pleasant Hill are funded majority by the cities. But there are lots of other funding sources that are there. So there are a number of other cities that are doing the same thing. And then Amanda mentioned an HDAP program. So we have some state funding for some of them. There's really a wide variety of funding sources, but the local team here is really a kind of a landmark investment by cities to bring homeless services directly to the people in their community. And I'll leave it to the city if you want to say anything else about that.
If June or Mayor?
June, do you want to talk about our funding with Martinez?
Yes, we have been really lucky to be able to work together with Martinez, and I would note also that we have a bi-monthly meeting with the city of the police chiefs and the city managers of Pleasant Hill, Concord, Walnut Creek, and Martinez. And the purpose of those meetings is to discuss homelessness and our joint approaches to them. So we have a number of different venues to have these discussions, but we have been lucky to be able to find the sources of money to split the cost between the city, the two cities. And the other cities have also, Concord and Walnut Creek, they have their teams also. And I don't know, Brian, if you have anything you'd like to add.
I would just like to expound just a little bit on that bi-monthly meeting. Is we recognize that homelessness is not just a Pleasant Hill issue, it's a regional issue, and certainly we know it goes certainly beyond that. But we've learned from years past, we can't just move somebody along from one city to the next, right? That's just passing the problem along. So we've learned to work together. There's also a monthly core meeting that more, as Amanda described earlier, boots on the ground attend and are very operational. The meeting that the city manager described is more policy driven, more future driven and vision and direction. And then we have a monthly boots on the ground operational meeting that occurs as well.
Anyone else? Okay. Let's continue with some of the questions in regards to housing and core. What is being done in Pleasant Hill to increase availability of affordable housing?
Yeah, I could start with that, June, then you can help fill in. We just did a partnered with Habitat for Humanity project, and that should be coming to light here real soon. We're also working with our senior. I think some of the slides that we saw, there's unfortunately a growing senior homeless population, and we're hopefully a future project with the Choice in Aging to develop low-income housing for seniors. And I think, June, is there anything else you want to add that's currently in the works at the moment?
Well, we have a number of requirements related to secondary units. Now, the state has kind of taken over this issue, but certainly we have always encouraged second units, and we have put within our ordinances that the second units that are built as part of new developments, that those second units have to be affordable. And that's another way of making sure that we increase that supply. By definition, second units are considered moderate. We have required that they be low income.
Great, thank you. Here's another one. Is a homeless population transient between locations and services? If they move between communities, how do they maintain continuity in medical mental health treatment? Do agencies coordinate in persons' mental health plans across cities and towns?
So if a client, I meet a client in Pleasant Hill, I start making a connection with this client, and I'm the one that's working with them. I'm the one that did the intake. I'm the one that starts connecting them to services. I'm going to follow them wherever city they go to. And then if I can't actually, if it's going to be a warm handoff, let's say they go all the way to Richmond and I can't actually get out there, I will actually go out there and make that handoff, introduce, but they always will be able to contact me no matter what. We like to follow our clients so we can make sure that they don't fall through the cracks. Does that answer the question?
Amanda, can I also ask, don't you have a close working relationship with the Walnut Creek Concord core team?
Well, absolutely. Well, every single team member, we all collaborate together, and so we don't want to leave nobody behind, and so, I don't know, everybody's great on my team, and they're great people to work with, and it's great to be able to communicate with them back and forth, and I have a hard time handing off a client because I want to make sure, that they're going to get whatever they need, but we work together well, and it happens well.
The other thing I wanted to, oh, go ahead, Amanda.
No, I'm good. Go ahead.
Well, so the other thing I was going to add is that in every community, there's something called HMIS, Homeless Management Information System. And so as somebody hits the front of the system and there's an intake and we kind of figure out what they need, that information all gets put into a database that is shared among all the homeless service providers. So if Amanda has a client that's in Pleasant Hill and they end up in Richmond, somebody who's working with them in Richmond can just look them up and say, oh, okay, so I see you've worked with Amanda. I see what you kind of already have in motion, and they can take it from there instead of having to start right at the beginning and not knowing anything about the person. And so that those data systems are really for homeless service providers, but they're all able to talk to each other and see what people have been accessing already.
And that really does work well by looking up that. It has so much information in there. We put our notes in there and everything like that. Thank you, Jamie. I'm kind of nervous. Thanks.
Great, thank you. Here's another question. I know that Mount Diablo Unified is partnering with NAMI. Thank you. I would like to know if Gigi or Jamie have anything to share with working with schools in Pleasant Hill or with our programs for homeless youth.
I could just share that we have always had an MOU with the school districts that we work with, and most of it is a preventive model where we're actually identifying students who would like to get ahead of feelings of being maybe depressed or anxious. And so we have a program called Ending the Silence. If several of our board members are actually former school teachers, so there's an extra sensitivity around ensuring that individuals are getting their needs met in school-based services. We don't necessarily run into a lot of people who are unsheltered in that younger age group at NAMI.
And there actually is funding from the federal government for students. And so it's called McKinney-Vento. And so we actually have the Office of Education. There's one person at the Office of Ed who basically has points of contact at every district. There's homeless liaisons at every district. And the county rep is actually on the Council on Homelessness. So we are getting a lot of information all the time about what's happening in schools and what are the services needed and all of that. So there is actually there are funded services that are specifically for students that are school age. And those folks are connected in with the sort of broader decision-making around homelessness at the county level.
And then if I may just add on a local level too, I know at the high school, part of the Rotary Club, one of our things is we're helping support the homeless students there and really working with the program there. A lot of people don't realize how many homeless students we have in our high school and other schools, and they're in desperate need of our support. And so we do have some stuff on the city level going on with our schools through a lot of our local nonprofits too to help support that as well. So.
Jamie, you could probably confirm, I've heard the population for Mount Diablo Unified homeless at around 600. Is that correct? Still correct, I should say?
You know, I don't know the exact number, but I know Mount Diablo has one of the largest populations of all the school districts of families and children experiencing homelessness.
So there's a real need.
So, you know, maybe we can touch upon this a little bit more. Can someone speak to the connection between education and homelessness? If 59% of the homeless population is in Pleasant Hill because they have a connection here, then how are we addressing the population before they become homeless?
That's a great question. And so I'll say I worked in public health for my entire career. And homelessness is the most complicated issue I've ever worked on because there are so many different things that contribute to it. And then there are so many different things that can help make it better. So, I mean, I think one of the things we've touched on here is mental health and drug and alcohol addiction are two pretty common contributing factors, but not always. And usually those are, often those can be the result of trauma. So there's sort of this connection of like trauma and mental health struggles and not just mental health struggles, but there's a lot of us have mental health struggles, but we're able to continue to function. And I think what we really see is people experiencing homelessness when they don't have the supports or the resources to function through hard and bad things, that they don't have a support network. And so I do think, that looking at what's happening for children in schools is really important, and helping them work on trauma and helping make sure that they have all the resources and supports. And I'm sure, NAMI's doing great work. But I think that's a real issue. The other thing I'll say is a lot of times, like when we've done just sort of not our full point in time count survey, but smaller surveys, we find that a lot of people that are homeless are living in the communities in which they grew up. And often what has happened is they've burned through those. So Gigi was saying, like, they don't have anybody. It's often that because of drug and alcohol issues or mental health stuff, they've burned through those relationships, but it's still their home. So just trying to figure out how to address that trauma early on can really be, can be really important.
And I'm thinking there probably could be more proactive approaches. Like if a family is deemed as being homeless, there's likely some mental health challenges available. And if not for the parents, definitely the children are experiencing some traumas. And so we need stronger connections and stronger opportunities to try and give them the support before they need it, and need it in a way that, sometimes they're not able to get it at the lower level. It's a psych emergency visit. We want to avoid that.
Is there any sort of idea on, because mental health treatment is often a long-term commitment, how many psychologists and psychiatrists, et cetera, are available to see some of our homeless patients? Are they county, private, or both?
Well, I'll share, we get phone calls all the time with family members asking us to please make a referral to them for their loved one is ready now. And we, of course, will have them call the 211 access number for the county. And sometimes we do hear back that it's a pretty lengthy wait unless they go over to Martinez, and they have to have the ability to get over there. And sometimes just the transportation barrier is enough for people not to go to the Miller Wellness Center. So we don't have the capacity at NAMI. NAMI is pretty much a resource organization, not treatment services.
Yeah, and I mean, there are private mental health providers throughout the county, and there's also the county mental health system. And one of the things that this is true for pretty much everywhere in the country, psychiatrists are in very, very high demand and very short supply. And that's kind of what's needed to, for example, like prescribe medications. So I think people do experience wait times for mental health. And as Gigi said, like what you want to do when somebody wants to get access services is you want to get them to it right now. And sometimes there are barriers. And I know that the county behavioral health department is really working always to continue to improve access. But there's really, it varies, and it can vary by somebody's health insurance, for example. And I know Kaiser's had big struggles with providing, sufficient mental health support. So it's an area in which there's a lot of work to be done to improve access.
Thank you. For our NAMI speaker, Gigi, the NAMI website, along with their mental health mission, discusses the goals for diversity, inclusion, and cultural equity. Please expand on cultural equity versus equality, and how our city government and public agencies would be administered and governed within a framework of cultural equity.
I think it's important to acknowledge the fact that there are racial disparities in all systems of healthcare. So when you start talking about how do we have an equitable system versus equality, you have to look at the fact of where people start from. So you have to consider their cultural background, their ethnic background, their financial opportunities. And then it's like if you were building a house and you said, we want to give you both the same house with all of the same features. But if you have a wheelchair user, you need to make an allowance for that with a ramp so that they can access the house. So I don't like using always ethnic examples, because equity is much more than just based on a person's skin color, how you make an allowance for them. It's also based on where they are today and what their needs are, and considering all of that as you plan for the city's need. We all know that any city that has a rich cultural diversity actually benefits the community. So when the city of Pleasant Hill is thinking about what do we need to do to have more balance and really be welcoming to all in their decision making around building lower income housing, there need to be fair housing practices that align themselves with having more equitable housing systems in place. We know that in the mental health system of care, one of the big struggles is African Americans receive their services in the most restrictive environment. So there needs to be a conscious effort that when someone is living with a mental illness, that we do not criminalize the mental illness, and we instead look at it as what it is, a medical condition. And that's why the training for law enforcement is so important around implicit bias.
Great, thank you. Now, I know there's been a lot of talk of this next topic, the whole defund the police conversation, or reallocate funds conversation. And I know, Chief Hill, of course, you can kind of touch on it, but maybe it's more of a question for Mayor Wren and June Catalano. Was curious about thoughts on the topic, what the thinking was with the city of Pleasant Hill in regards to that.
Yeah, I can go start off, or June, do you want to start off first? You're muted, June.
Yeah, go ahead, Matt, and I'll follow up.
Yeah, well, definitely, given prior to the recent circumstances with the COVID thing, we've had to reevaluate our budget in general during the shelter in place and everything. It's going to have a huge impact on our budget in general. So there was already big conversations going on within the council. We have a budget committee really looking at a lot of the numbers, but segueing into the term defund the police is really actually creating more programs and opportunities. And so really, how can you create opportunities in other programs, but yet also fulfill our mission of protecting our community and the services for the people of our community and businesses. And so that's a tough, hard look at it. And we're learning, and we're analyzing a lot of things. And even like the speakers here today, whether it's mental health services or homeless services or a lot of other programs. I mean, we can talk about health. Our person from Gigi from NAMI was talking about health availability. And there's a lot of things, educational system, whether it's the school district and programs with the school district and after school. And I mean, the list goes on and on. And so what are the top priorities? And that's why we're having these discussions, because we're listening, and we want to reach out to the community and see what those priorities are. And then based on what those financial needs are and what the community needs are, funding those appropriately. But those are all conversations that are being had right now. And a lot of our funding, and maybe our city manager will go into it, is really county and state and federal based, and not making excuses by the size of our city, but we are a smaller city. We don't have a lot of larger budgets as a lot of our neighboring bigger cities. And so a lot of that is really collaborative with other cities. I wanted to give a kudos to the mayor of Walnut Creek, Luella Haskew, who has sent a letter, and all the mayors have signed on to it, about the need for greater funding, especially the Miles Hall situation And really, for that, it's got to be a county approach. It's too big of an issue for just any one city to tackle on its own. And we need the support of our county supervisors and the appropriate funding for appropriate mental health services throughout the county. And I mean, no disrespect to mental health services, but mental health is just one cosm of that big piece of pie of a lot of areas that need help at this point. And so that was just kind of one example I came up with. June, did you want anything?
I would just add, thank you, well said, Mayor. Our police chief has worked really hard to make sure that our police force is more than just about public safety. It is really about providing the kinds of services that people need. And the fact that we were one of the first cities, along with Martinez, to invite CORE in and to work with CORE, I think is a good example that of how that our chief has looked at policing in a very broad way. And I think we've seen the results to date of a lot of good things happening in that way. And I really just want to give credit to him for really making an outstanding effort to make sure that we're more than just safety.
Thanks. Lloyd, I'll speak to that just a little bit from a very local perspective, because that's a national conversation. And I would offer this. Well, first I'll offer this, is I have been working super hard not to become defensive on any of these conversations and topics, and to be quite frank with you, for us as an organization to look at them as opportunities for growth and to get better. And in being completely transparent, I think it's also fair to say that I'm fully supportive of the work that our people are doing. I love them. I know their hearts. I know what they want to do in the service that they want to provide for our community. And with that said, we're not perfect, and we will strive to get better. And so with that topic, I say, well, as an organization, we are small. We haven't grown in numbers in many, many, many years. Yet, certainly our calls for service have increased, and probably more importantly, the complexity of our calls for service continue to increase. We, as police departments, are continue to ask to do more and more, and I think that's part of our conversation, right, Gigi? Isn't that what we're talking about? And right, Jamie and Amanda, could other professionals provide same or better services to deal with different populations who are experiencing different things in their lives at that time. But at the same time, as communities, ask for us to continue to engage in community-oriented policing, to revamp and review our policies, to become a fabric of our community, to continue to increase and better our processes and procedures, and to defund at the same time. Sometimes those are in conflict. So we have to have that balance, and we have to have priorities. So I already mentioned we haven't grown in years. Our budget hasn't increased except by cost of living. City Manager Catalano, if you could just confirm that, and Mayor, but we are not growing. We're not growing, and we don't have many programs. So from a local perspective, I don't know that there's a whole lot of defunding to do. From a national perspective, I think that some of this is, can others do the job that police departments are doing? And the irony here is, I think police chiefs in particular have been saying for years, more and more continues to be thrown on us, quite frankly, because we're here 24/7, right? And nobody else is responding 24/7. No one else is responding on Christmas morning at 2 o'clock in the morning, other than the police. And so I think by virtue of that, a lot of this has fallen onto our plates. And so I think we've been saying for years, Jamie, you've heard me say, Mayor, and I've said this at council meetings, if we're talking about homelessness, homelessness is not a police issue, it's a societal issue. And so while enforcement is part of that, when public safety becomes an issue, all the enforcement in the world is not going to make homelessness go away. So we take a very appropriate balance for our community, and that's in terms of being compassionate right? But firm at the same time to keep our community safe. But we recognize that there's other partners that need to, help us get where we want to get. So not threatened by the topic, but nonetheless, I don't know that there's a whole lot to define here.
I'd also like to, if I have the opportunity, to share my views around defunding. I would never want to live in a city where we didn't have law enforcement. So the terminology kind of puts me off. I do think that each city has to take a look at their budget and start doing some prioritizing. If you are in a city where you're responding too often to mental health response, and that's not how most police officers, when they joined the force, they didn't decide they wanted to be social workers and go out and have all these response to mental health crisis. So I think it's important for us to look at prioritizing where dollars should be in any city, in any household, and then making decisions based on that. But it has to be by city. And if it's Pleasant Hill is already operating in a fashion where there's no funds to shift and they're not overburdened with responding to mental health, then they may be one of those cities. And I'm not saying I know that they are, but they may be one of those cities that you would look at different. But there are cities that would possibly benefit from prioritizing funding towards social services program, in particular mental health, so that officers are doing the work that they went into the police force to learn to do to protect and serve, versus responding to sometimes calls that are putting other citizens at harm because they could be dealt with at a lower level. I'll just say that. I haven't done the analysis for Pleasant Hill, but I know there are some cities, and we're definitely with the Friends of Scott, Alexis, and Ton Hall looking to see, could we come up with a non-police response, and would cities, based on their size and their ability to support the effort, be willing to join in this mutually beneficial opportunity to take a burden off of police that should never have been there in the first place?
Mayor Rinn or Manager June, any thought on that last point by Gigi, as far as kind of having more of a coordinated effort in those non-police responses, and Chief Pill as well?
Yeah, I mean, obviously, Chief Hill can speak for himself, but, to ask our police officers all the things we ask of them to do these days, I don't think it's fair to them. I think, I have full confidence in their training, and, we do the de-escalation techniques, but really some of those scenarios, you'd want a social worker or somebody in that capacity to come in. Just, all due respect to our officers, but sometimes if you show up in a uniform, it kind of escalates the situation by just the visual appearance, even though they're coming there to help support the situation and de-escalate it. So yeah, if there's a better mechanism to do that, and which is what I'm hoping the resolution from the county will come out with, is that we will have a program similar to a core program for the homeless side, where we have a program for mental health services that will be able to be dispatched as well from cities. Because unfortunately, it's all too common out there and I don't know the statistics of our mental health calls in our personal police department, but I'm sure it's between homeless and mental health services, it's probably a good percentage. And if we had a special team there, obviously our police would support if the situation does get to a certain point, because we want to protect them, supporting themselves, their family, and other people in the community. But I'm a big fan for the social worker approach to try to do that. And similar to the core, to build the relationships. And it's just a broader conversation on just county health services in general, which is severely lacking. And Gigi may add to this or be more knowledgeable. I'm not sure. I know there's only just a few beds at the county hospital when somebody comes in, and I don't know, I want to say 13 off the top of my head, or what's the number, Gigi, do you know?
Well, there's more than 13, but the system was designed in such a way that it was for emergency services for mostly people with severe mental illness, and then you have others who use it. So it's no fault of the county
Right.
that we don't have enough beds, but it's very frustrating. And I've talked to law enforcement to take someone for a 5150 and see them get released in 2 or 3 hours, long before they've had an opportunity to be stabilized. So obviously what we have in place is not working, and it's, for me, not fair to officers.
Right. And not to put you on the spot, but since we're here to listen and learn, I mean, what are your thoughts on what we can do better as a community to help in situations? Because that's what we're hopefully learning from this conversation, is what we can do better. You know, whether it was from an enforcement side, you said it's not the county, where's the gap that we can help?
Well, I do think in other counties, the county has taken the lead on looking for solutions around relieving the burden off of police officers. And I think that some have done it through Mental Health Services Act dollars, and some have done it through the general fund, that, you know, the general taxpayers fund. And I think we're at that point where it should be explored. We would like to see a program based out of Walnut Creek, because that's where Miles was killed, with support from the participating cities. And we can pilot it and figure out, what does Contra Costa County need to address this? I think Contra Costa County has the talent to lift up a program that would be a model for the nation.
Okay, thank you.
Yeah, we kind of had like just kind of an add-on there. Is there some way, and I know obviously with budgets and everything, with the loss of jobs in the COVID situation, but would there any way be possible somehow to propose increase in funding in mental health issues, thereby taking a burden off the police without reducing current funding for our police? So.
Say maybe June, do you want to answer that question?
Do you mean in terms of, can you say that again? You're muted.
Sorry about that. Basically finding additional funding for mental health services. So we probably need more funding, actually, realistically, for our police services, obviously, especially in these current times. But finding ways to find additional resources to specifically focus on mental health and non-police response.
Well, certainly there are sources of funds that are available through grants and other opportunities that we're always looking for. In terms of the county, I'm not sure where we would find additional funding. I do know that there's been some proposals, as we did with CORE. We split the core services with another city, and certainly we're always looking for opportunities to join with other cities to see what we can do to make it more efficient. In terms of additional money, that there's very, very limited ways that cities can raise funding. So I think this is a difficult time with the difficult financial situation. I don't know that city could do it on a local level, but I certainly think we can find ways to partner with other people and to make the money we have go further.
Great, thank you. Did you want to add anything, Chief Hill?
I don't think so to that conversation. No.
Okay, great, thanks. Is there a way of redirecting calls to the police to more appropriate services based on the nature of the call, or an easier way for citizens to know what service to call, or kind of help redirect?
Jamie, do you want to talk about 211?
Sure, thank you. So yeah, this is a big issue, and you heard Chief Hill say, like, police is not really probably a big chunk of your calls is, I see somebody that's homeless on the street. There's not really a role for the police in that. If somebody's breaking the law, okay, that's a different story. So we now have 211 as, and it's been around for quite some time, but we've done a lot of work in the last probably 3-4 years, the homeless system of care around 211. And so it's literally you dial 211 like you dial 911. It's free. There's somebody, a live person that you would get 24 hours a day. And that is how you would connect with core dispatch. So if, for example, you see somebody that is experiencing homelessness and you want somebody to go check on them, you could call 211 and leave a message with core and say, like, this is a general description of the person. This is where I typically see them. This is what their car looks like. Can somebody just go out and check on them? Core is not an emergency response. So it's like, if I see somebody who's experiencing homelessness that got hit by a car, like, you would call 911. But 211 is a great way to just sort of start the process of getting connected to services. Even if you're not quite sure what somebody needs, the 211 staff can actually help walk through that. So that's really a quick, easy resource that people can always start at. And so you don't have to keep a whole resource list in your bag or at your office. You can just start with 211.
I'd just like to add, also training for the dispatcher taking the 911 call is also important. They can kind of do some of the triage around whether this merits an officer going out or not. And too often officers go out to support family members. We don't have a problem with the dispatch officers giving our NAMI number and letting us talk to the parents, because I get calls all the time and I said, no, that does not merit calling the cops, not at this point. Tell him he can't go to the movies with his friends. He just can't go.
So we have direct dispatches that come into our phones, as well as the officers can call us directly and say, hey, this person's out here, you know, or we'll get the text via a dispatch app, and it says all the information in there. We show up there, and that's our starting point at that time, you know. And so we start, we give them bottled water, we give them some food, we find out what's going on with them. You know, we find out how we can help them, you know, and then that's how we meet the people, and that's how we, you know, then we know who they are, and then every time we see them, we stop and give them more snacks, clean socks, hygiene, you know, whatever we can, and that's how our relationship goes to maybe the third or fourth time, and, you know, they start asking us, and maybe they want to give us their name this time, you know, and so then now they're trusting us, and they come to find out maybe they want to leave state because they have a relative, and so then we coordinate. So it's all about building that relationship. So those calls that the police department get and that are dispatched to us is our door entry to the, you know, helping person.
Great, thank you very much. I know it's 7:30, but I think we're having a really good conversation, so I'm going to continue it for a little bit longer. Yeah, keep those great questions coming. We're having a great conversation here. This next question, I'm going to try to wrap a few questions into one. Knowing the mental illness situations that have happened, case in point, Miles Hall, you know, our autistic youth, autistic members of our community who sometimes have a different response when approached with, you know, difficult situations. And then, of course, our homeless population as well. What type of training are our officers being taught to deal with those type of situations?
So we start with one of our planned learning domains in the academy. It's a 15-hour block of training for those with disabilities. And then, as I discussed last time, we send every single one of our officers to crisis intervention training. And that dealing with individuals with disabilities is also included in that. And as we talked about, de-escalation is a big part of that, and recognizing disabilities compared to other issues that individuals may be experiencing, like intoxication, confusing the two, or somebody who's refusing to comply versus somebody who's actually autistic and is unable to respond in a way that an officer may expect. So that's included in our crisis intervention training as well.
We also at core go through mental health first aid, and we have to do that every year. So that's updated, all the new information, be able to teach us how to respond to, like you said, if we can be able to tell if they're having some kind of mental breakdown or they're just, you know, having a hard time. We're trained on all that. And so that's yearly that we have to do that.
And then also,
oh, sorry, go ahead.
no, go ahead, Amanda. I'm sorry.
Oh, as we do it more and more, it's easier to be able to do that, you know, as we are trained more and more the longer that we're out there. So.
The only thing I was going to, from a city perspective, obviously the accountability component, and kudos to our chief who is continually analyzing their practices and procedures. And you even put out a memo recently. It's just with all their things that were going on, we just wanted to make sure that we were doing the right things. And section 438.6 talks about de-escalation. It says officers should consider that taking no action or passively monitoring the situation may be the most reasonable response to a mental health crisis. Once it's determined the mental health crisis and immediate safety concerns have been addressed, responding members should be aware of the following. It talks about safety conditions, introducing themselves, attempt to obtain the person's name, be polite, patient, courteous, avoid overacting, speak and move slowly in a non-threatening manner, moderate the level of direct eye contact, removing distractions or disruptive people from the area, demonstrate active listening skills, summarize the person's verbal communication, provide sufficient avenues of retreat or escape should the situation become volatile. Responding officers should never use stances or tactics that can be interpreted as aggressive, allow others to interrupt or engage the other person, corner a person who is not believed to be armed or violent, or argue with the individual. So just reinforcing our practices from a police department and what they're being trained and what the expectation is. Obviously, there's always room for improvement and things to do, but just wanted, you know, one of the things that we were looking at from a city perspective, and it just reinforced our confidence in our police department of the policy and procedures we have in place and what we're doing. So I just wanted to say that component as well. And kudos to Chief for continually analyzing what they're doing and their enforcement for that. So thank you.
Thank you. Is there a specific implicit bias training that your officers go through as well, especially since everything that's been kind of going on throughout at the national level, I should say?
Yes. Yeah. Again, there is a learning domain in the academy. That's where it starts. And then we are meeting our California police officer standards and training requirements for implicit bias, racial profiling, and cultural awareness, certainly. But as I mentioned in our last conversation, this is an area where we've identified where we can improve. And we've already are in the works with our partners to the north, Martinez PD, in scheduling and hosting an implicit bias training for both of our departments. So thanks for conversations like this. We're being very introspective and looking at ourselves and looking at these places and areas where we can, you know, kind of dig deeper and get better. And so that was an area where we recognize, hey, we can improve here. So we're working.
I'd just like to share a statistic because of the headlines. We often hear about unarmed African-American men who are killed, but actually the number one group of individuals who are killed by law enforcement in tragic situations are actually people who live with mental illness. So that has to also be a part of the conversation, not just the ethnicity, but the fact that people with mental illness, and especially people who have language barriers. So it's not just that they're, you know, not able to understand the command because of their mental illness. Sometimes it's their language barrier they're not able to understand. And so the implicit bias training that I used to facilitate, and I'm available to support the efforts in Pleasant Hill or anywhere else that I'm called, was developed based on the law enforcement officers training each other about what you might see from the different ethnic and cultural communities when a person lives with mental illness, a tool that was developed by NAMI, and then I kind of shifted it around. And I think it gives the officers an opportunity to talk about some of the challenges that they face in their, you know, particular areas that they cover. if it's a larger than usual ethnic group, they learn from each other. And I think sometimes you have to look for opportunities to have courageous conversations because these are very sensitive topics. And so just going to a class and taking it and kind of checking the box, no, you can be a part of the solutions. And I've had great success with breaking down barriers and filling gaps by creating a safe place to have conversations.
Great, thank you. As far as looking at, some of the different trainings, speaking of MDUSD, what training does the PD, and that could be part of what's already been addressed, but what training does a PD provide for the SRO to ensure discipline and interactions that do not disproportionately impact our BIPOC youth? And what accountability data does the police department collect regarding these interactions?
So I will just say that the emphasis for our school resource officer has always been, well, it's new. So we're just 2 years back into it after I think an 8-year hiatus, if my memory serves me correctly, or maybe longer. But the emphasis has certainly, without question, been relationships and not enforcement. Then, in addition to that is he very strictly stays out of administrative issues, right? And so if a child or a student is just being disruptive or tardy, that is no place for the police department to be involved in. We're, about education, right? And building relationships and prevention as much as we are able. That doesn't mean that enforcement doesn't happen, but because it does, certainly on a rarity. And when it does, it's much better when it comes from an individual who all the teachers and the staff know and have prior relationships with. And so we brought that position back 2 years ago, really at the request of our community. And it was really met with overwhelming success. In terms of bringing analyzing stats regarding his efforts, we don't have the stats on what he may have done in terms of enforcement and certainly racial breakdowns and stuff. That is not anything that we've analyzed at this point.
And if I may on that, Lloyd, as well, just the comments and the feedback that we've gotten from our SRO at College Park High School and the other schools have been community education. Unfortunately, not a topic we're talking about, but unfortunately, there active shooter drills and things like that in education. I have 2 daughters in middle school right now, and that's another topic for another time. But having that relationship and having that trust and building it at a young age, it's really educational, like the chief said at this point. But it's also good for our officers if there's ever a serious situation on one of the campuses, that they're familiar with the campus and the people and are able to react quickly and help save lives of our school-age children and teachers and staff.
Great, thank you. Let me switch gears just a little bit. A question came in regards to the eviction process with everything that's kind of going on with what's happening on a national level. The question was, is there any sort of, I would like to ask the city to take on the task of potentially letting folks know about the no eviction mandate and finding and kind of briefly talk about any ways that we can let people know that information about the no eviction mandate.
I can take that. In our May-June outlook that went to every household in the city, we did go over the county's actions regarding the moratorium, and we have also put that out on social media. And we will continue to do that. We are very lucky to have Gail Vassar, our community relations officer, who makes sure that we do push out information like that. We will continue to do it.
Great. Any other new education or commitment for future, such as the 8 Can't Wait or other initiatives?
Sorry, Lloyd, I didn't understand the question.
Any new education or commitment for the future, such as the 8 Can't Wait initiative or others in regards to that sort of situation?
I'm not sure how to answer that other than, 8 Can't Wait. We responded, I tried to respond clearly where we stood on that. When other questions come up, we will certainly try to respond as fast as we possibly can.
And I believe their document is on, I have it and I can't see it when you're remote, and it's blue. But we do have a document that our police department did put together about the 8 Can't Wait. And I did join and sign on with the other mayors across the nation to partner with our police department to go through all that too. And part of it is definitely having the community conversations as well and continuing to work on that going forward. So continued outreach. We have, I believe the police department responded very amicably to everything that was addressed in there, but we're always open to suggestions and feedback going forward as well.
Of course, since this is a social justice kind of community conversation, wondering if there's any other issues that we might have kind of missed, because we're going to need to wrap up pretty shortly. Any other issues that you might want to speak to, or that maybe we haven't touched upon this evening?
I could share because you mentioned the 8 Can't Wait. I don't know that I've bought into all of it, but I will say we do need to look at when one is responding to a mental health crisis, that it's probably never going to be a good idea unless the person is armed with a deadly weapon for law enforcement to show up with guns out and guns drawn. If there was some type of policy that we can have in place where when it's a mental health crisis and you understand the person is not armed, that the officer should not, I'm just trying to avoid what happened to Miles ever happening again. And I just cannot wrap my mind around the fact that it was shot and killed so soon after law enforcement showed up on the scene and that they had guns. So they were saying they were fearful, but there would have been a different outcome had they not been armed coming to intervene for someone who was in a medical crisis.
And I will also say is that, over the past few years, we as a profession we're not perfect, but have improved substantially. We often will get to a situation and our goal is to get all the family members out, right? And if the person is in crisis, that person could stay there, in crisis, and we or someone else could speak to them on the phone. And often we just kind of walk away, and for the most part, they will usually, people cycle through these things, and they'll kind of cycle back, and the family will know when it's safe to go back. So it's really common these days for us to, as our officers are, en route, either our dispatchers or a police officer will get on the phone with the reporting party and try to speak them out of the house. And now we have time. We have all the time in the world, and there's no reason for us to enter that house, in the first place. There are things that make it more problematic and difficult to deal with when folks are out on, public streets and other things. And, Gigi mentioned language barriers and all these millions of different scenarios. But we're certainly getting better. We're learning. Unfortunately, we sometimes learn from other incidents, but we're certainly doing all we can to learn. Gigi, if I can share with everybody, with the world, the conversation that we have, we're trying to put a crisis intervention team together. This is a little bit separate than what Gigi has referred to as a non-police response. but there's always going to be situations, unfortunately, where police are required in violent situations. And so we are trying to get, the most highly trained and those people who are most inclined to be there and to be successful in those situations to arrive at those situations. So we've been looking at this from a regional standpoint. We've had conversations already with behavioral services at the county with Gigi and NAMI and others, because we're trying to put the best processes, in place. And I think if it weren't for COVID, we'd be a whole lot further. We met in March with Dr. Trabano with behavioral services, and then of course, the pandemic came and it seriously hampered our efforts, but that is not put away. That is something that we are committed to, and I look forward to what that will look like.
And there's also opportunity when needed to use less lethal, I guess I'll say, weapons, like we talked about the bowler wrap, and that had mixed reviews, but I think there's opportunities to explore less lethal weapons, even when a person is, in a rage because of their mental illness.
I agree.
All right, one more, and then we're gonna go ahead and wrap up. And it's already been, I think it was actually addressed at the last, at our last conversation, but has the Pleasant Hill City Council issued any kind of statement in regards to Black Lives Matter?
Well, as I mentioned earlier, they have, in 2017, the City Council did adopt a resolution, and that is available on our website. And the resolution was very clear that the city is, and I will just go over it one more time, they're welcoming, inclusive, tolerant, and safe for everyone. So they have certainly have a resolution and a record of what the council's intent. I don't believe they have done, as a council, they have not done anything related to Black Lives Matter.
I do remember, though, that both Chief Hill and Mayor Wren, as Mayor, you're part of the council, correct? Or kind of the head of the council?
Yeah, I'm a council member, and then one of us is a mayor who presides over the council, but I'm one of 5 members of a council, correct?
Yeah, because I know that you did respond last time, just as a personal, as Matt Wren, Mayor
Yeah.
Matt. But,
and I believe a lot of the other council members have participated in protests and things on their own, and supported Black Lives Movement and other protests throughout the city. And our chief was a part of protests as well, to help lend his support and officers to make sure that everybody was safe and can peacefully protest. So
perfect. Thank you. So really quickly, because we just have a few more minutes left, would each of our panelists, starting with Catalano, like to share any final closing statements at all this evening?
Well, I would just like to thank the panel and everybody who watched and participated tonight. I certainly will take back to our staff the discussion that we had this evening, and we want to hear from people. People should always feel free to call us with questions or ideas. We're there to serve the public. So I just want to thank everyone for having this event this evening.
Great, thank you. Ms. Crowder?
Well, thanks for having me here. And I just want to remind people, yeah, Black Lives Matter, but Black minds also matter. So I shared the statistics. Black minds also matter. Thank you.
Okay, thank you. Ms. Jeanette?
Thank you again for the opportunity. I really, I'm always happy when I get a chance to let people know sort of what the services are and what the current state is. And I also really have just appreciated the leadership of Pleasant Hill on this particular issue around homelessness. Y'all have been exemplary. Thanks.
Ms. Cruz?
It was a great pleasure to be on this panel tonight. I really do appreciate it. A great experience. remember, if you see someone homeless and you think that they need help, please call 211 so we can get out there and connect with them. Thank you.
Great, thank you. Marin?
Yeah, just kudos and thank you for everybody. And like we said, this is just a microcosm of all the conversations. There's many things that we could have discussed here. And, you know, even the subject matter we discussed here, it's not over. We need to continue that and keep moving forward. The other two coming up meetings, we'll have 2 other council members, different ones. So by the end of this, you'll have the perspective of all 5 of us. And it's just another way of showing how unified we are in this conversation and actions going forward. So, you know, certain legalities that we count all 3 of us, more than 3 people, 3 or more being on the same call, or it becomes a council meeting. So we definitely want everybody to participate and the general public to kind of hear all their perspectives and let them know that all the other council members are part of this conversation as well. And we're really taking this seriously as a city.
Great, thank you. And Chief Hill.
Thank you, Lloyd. Thank you to, first of all, our community for submitting questions and participating with us. And thank you, Amanda, Jamie, and Gigi for being here and helping us make Pleasant Hill that much better. And I think it was Gigi who mentioned we need to be willing to have difficult conversations. These are conversations that we as a society weren't having a year ago. And sometimes they're uncomfortable, but we just need to buckle down and be willing to have those conversations. So I appreciate that we're doing it. I appreciate that we're doing it in a public forum. And Lloyd, thank you to yourself and the Civic Action Commission and the diversity team for putting us together and facilitating these difficult, challenging, but improving us conversations.
Great, thank you. Thank you so much once again to all of our excellent panelists. As a reminder, today's webinar will be posted on the Civic Action Commission Diversity webpage, www.pleasanthillca.org/diversity. Although there are a lot of great questions addressed today, I know we are not able to address all of your questions. So this has been a continuing point, and the City of Pleasant Hill leadership will be continuing these conversations in the future. At 6:30 p.m. on Wednesday, August 12th, we will continue the conversation with social justice and the role in the faith community. Panelists will include members of the Pleasant Hill City Council, members of the faith community, and Police Chief Brian Hill. And Wednesday, August 26th at 6:30 p.m., we will continue the conversation with social justice and the youth. Panelists will include students from College Park High School and Diablo Valley College, Police Chief Brian Hill, school resource officers Brent Botello, and members of the Pleasant Hill City Council. Should you have any immediate questions for our panelists, please use the Civic Action Commission Diversity Committee email address. That I think will be popping up on your screen shortly. And we will be able to connect you with the correct person in that case. Be sure to look out for more information in the upcoming weeks for more community conversations with Pleasant Hill City officials. Please stay safe and healthy out there. Thank you once again for attending the community conversations, and have a wonderful evening. Thank you, everyone.
Thank you.
How about